In this presentation, we will briefly discuss case examples and best practices of telepharmacy observed during the COVID-19 pandemic. The Canadian Society of Hospital Pharmacists defines telepharmacy as the use of telecommunications technology to facilitate high-quality pharmacy services where the patient and the pharmacist cannot have direct in-person contact. With the current pandemic, pharmacists experience many challenges, but as well as opportunities, and in one of these areas is telepharmacy. Factors where there's limited access to face-to-face visits, such as remote location, poor access to transportation, mobility challenges, or inflexible schedules, make virtual visits or consultations conducive, or restrictions in visits, such as what was imposed during the pandemic, also gave us a lot of opportunities to practice this. Patients, however, who have overt memory loss, cognition impairments, vision or hearing limitations, or anxiety about technology don't make ideal candidates for virtual visits. Not every consult requires a video visit, particularly if the patient is comfortable receiving the information by phone. Complicated reviews who are having visuals of seeing tablets or vials or direct observation to see inhaler techniques will require a video. From the period of March 2020 to June of this year, we saw many pharmacy services delivered through virtual visits, such as medication education counseling provided over telephone, complicated medication review to address discrepancies while reviewing medication home supply over video, and implementing adherence aids such as a blister pack with the use of video coupled with email to send and validate detailed instructions to the patient and their caregiver. Preparing for virtual pharmacy consults, we need to ensure that several aspects are thought through. First, patients should prepare to gather their medications and adherence tools or devices, including recording notes such as a notepad or a pen to prepare for the virtual visits. They should also be advised that they need a quiet, private space where distractions are minimal and interruptions can be minimized as well. Likewise, pharmacists also need a dedicated space to conduct telephone or video visits to ensure privacy. Connection needs to be tested prior to the consult to ensure quality and continuity. Presently, platforms such as Skype, FaceTime, and Zoom are allowed to alleviate pandemic burdens, but over time, pharmacists need to plan to move to a secure platform designed specifically to protect patient privacy and adhere to jurisdictions' regulations. Patients need to consent to be made aware of the risks and benefits along with privacy and security limitations of whatever virtual medium they choose or is being used. Pharmacists should also still follow required standards of documentation, including reasons for the virtual consult and the medium that was used. As we move forward with virtual care, we need to keep in mind that there are limitations to virtual and remote care. Patients experiencing low income or socioeconomic status or reduced digital literacy may have difficulty, and pharmacists need to be aware of this to avoid magnifying pre-existing inequalities. In a recent CMA survey in June 2020, almost half of the Canadians who received virtual care during the pandemic want to see it continued and further expanded. This is an opportunity for pharmacists to take part in this evolution, but it needs to be combined with research and application so that we will be able to determine a sustainable approach where we'll need to move this forward. Thank you.